Hello everyone, I, Dr. Shalini Chawla Khanna, bring warm greetings from Max Healthcare. Today, I would be talking about the role of hysteroscopy in infertility. The successful implantation or pregnancy requires a crosstalk between the embryo and the uterine cavity or the endometrium. The analogy is like the seed and the soil. The plant grows if both the seed and the soil is healthy. Similarly, if the embryo is healthy and the uterine cavity is normal, which provides support to the developing embryo, the chances of conception increases. The uterine factor abnormalities are reported in 5 to 10% of the infertility cases. Thus, it is essential to evaluate the uterine cavity before the patient goes in for advanced fertility treatment like IVF, that is in vitro fertilization. And hysteroscopy is considered as the gold standard for looking into the uterine cavity. It is see and treat. That is, it not only helps in diagnosing but also helps in treating the pathologies at the same sitting. When is it done? Hysteroscopy is preferably done in the post-menstrual proliferative phase of the cycle, that is day 5 to day 11. It is done as a daycare surgery. The patient comes in the morning and goes back in the evening. With finer telescopes available, it can be done as an office hysteroscopy without anesthesia. And how is it done? The telescope with the camera attached at the back end is introduced via the vagina, cervix into the uterine cavity. The cavity is distended with the fluid medium and the images are displayed on the TV monitor. Now, there are two main issues in hysteroscopy with infertility. Do all patients undergoing IVF or in vitro fertilization for the first time require hysteroscopy? Well, this is a very debatable issue and each patient needs to be individualized. However, if there is no abnormality detected on the transvaginal sonography, there are no dilated tubes on hysterosalpingography, and sono-saline infusionography is normal, then in those cases the hysteroscopy can be avoided. But if there is some finding, then it should be done even before the first IVF cycle. Now, the second issue is recurrent implantation failure. Patients with recurrent implantation failure usually have some positive finding. Either the endometrium is thin or the ultrasound shows some organic lesion like fibroid, polyp, adhesions, or there could be a congenital anomaly of the uterus like septate uterus or bicornuate uterus. Then in those cases, hysteroscopy is desirable as hysteroscopy picks up 30% of the abnormalities in cases of recurrent implantation failure where these findings have been missed on an ultrasound. So we at Max do all advanced hysteroscopies related to infertility, as at Max we are eager to get you home with a healthy baby. Thank you.